Safely trying to muzzle a patient, first you got to make sure you have the right size muzzle. You don't want something that's too big or too small to go over the muzzle, but you just simply go up right behind the patient and muzzle them, and then make sure that it gets securely latched. And then sometimes you do need an extra pair of hands depending how the patient is acting, but normally I like to kind of stand right behind them so they don't have too much room to back up. You have to go over the neck and then tighten it and then do a twist to make sure that the tighten is secure so the patient or the animal can't get close to you and you're able to keep them away a safe distance. A cat towel. When restraining a cat. So what we typically do is with a towel, we kind of make them a nice kitty burrito. Sometimes we'll poke their head out, depending what we're using. I'm going to shave up the prepuce area very carefully with a 40 blade. Chlorhex solution around it. And I'm going to rinse it off. Okay. And then my assistant's going to expose the prepuce area for me to clean. Just clean it slightly. And I'm going to rinse it. Now I'm going to glove endotracheal loop. Can you look up how old Moxie Lawrence is? So now that I have my gloves on, I'm going to sterilely take out the red rubber catheter. And then I'm going to place lube on a sterile field. And then I'm going to insert into the penis. You're going to have to push it out more. I know you can push it out more without touching it.
Hmm?
Yes.
There you go.
There we go. Okay, so now I'm going to need it cut. More than that. More. There. Don't make sure you don't touch it. Okay, perfect. And then I'll take a syringe. Good boy. draw back. So I did a midstream catch, so I let the urine come out for just a second before I place the sterile container underneath the patient and just let him urinate. So first, this is a male, so I'm going to move the prepuce area out of the way. I'm going to look and check for the bladder. And if it's a large enough bladder, make sure there's no masses or abnormal things inside the bladder. And draw back. Anal glands. So I'm going to lift up the tail. I'm going to feel for the anal gland. I'm going to have a towel in front of and oh, okay, perfect. I'm going to rotate it out. You know what we need to do? Both of them I know, I'm sorry, buddy. I'm rotating the anal gland out and squeezing very gently. Now I'm going to this guy has black nails. I know, I'm sorry. So I'm just going to trim a little bit at a time and see where I'm at. So I see a little bit of the beginning of the quick there, so I'm going to stop and not go any further. It's okay, so you expose the nail, and then you trim right before the quick. And just expose the nail. Obviously you can't go too far back because you don't want to quick. And then always make sure you dog with Pepsid. Before he eats, I'm going to open the mouth, I'm going to muzzle, I'm going to put the pill in the back of his throat, close the muzzle, hold, do a little rub, make sure he swallows it, and doesn't spit it out. Just swallowed. Tablet of Pepsid. I'm going to hand pill her. Make sure I put it in the back of her throat. We'll let her swallow it. Make sure she a little bit of the ear cleaner solution in the ear and do a nice squishing noise to break up any debris. I'm going to wipe out. To get some debris out. I'm also going to make sure it's dry. It's really dry from the ear solution. And then I'm going to put a little bit of Dermalone in it, just a little bit to treat because he has a minor ear infection with yeast. And I'm going to rub that in. Good boy. Addition with the cotton ball.
Cinder.
Come here, Cinder. I know, you're a good girl. I know. So I would take the cotton ball. Cinder, please be a good girl. Thank you. Take the cotton ball, kind of put it in her ear, do a nice little swish with the cotton ball, and then wipe out her ears. I know, good girl, good girl. Into her ear that I just cleaned. One, 2, 3, 4, 5. I'm going to do a nice little massage on the base of her ear. And that's how you perform an ear cleaning and ear meds for a cat. This is my dog. We're treating a minor skin infection. If you look up underneath his skin, he has little pustules, and then we'll be spraying Betagen spray. Here's a better look. Just a little bit of infection right here. So really, about twice a day I would spray him with the Betagen spray and spray him right here to properly put on a topical. Stethoscope, very similar to gastric intubation. This is my anesthetized patient. So what I'll do is I kind of lift. I have lube on the stethoscope, and I'll just slide it right in. And then go so far down, and then I would listen. Make sure I hear. Okay, so I'm going to do a shimmer tear test. I'm going to place one in his left eye. Down right here. And I'm going to hold it for 60 seconds. Okay, so this is the Tonovet pen. I'm going to load it without touching into here. And then I'm going to readings at 11. Yeah. Sure. So I basically go to AFib 700. Okay. So I got an average of 10, 11, and 10. For the average of each reading, I was pressing it multiple times because it takes multiple averages, and then, or multiple readings, and then averages is out, so we get 3 averages. So I'm going to stain the eye. I'm going to put a little droplet that eye, and as well as that eye of stain. And then I'm going to flush the eye. Okay. And then I'm going to turn off the overhead light. Hey, Henry, do you mind turning off the overhead light real quick? Perfect. And then I'll put the black light on. See if there's any uptake of stain, which there's not, so there's no eye ulcers present. Okay, so when doing an enema, I have lukewarm water. I'm going to take a significant amount of lube, squirt it into the bowl. I'm going to mix it up really, really well. And make my solution. I'm going to take, I'm doing a dog, or I'm going to fake doing a dog. I'm going to put it in a 6 cc syringe, the tube, or the syringe. So a little bit smaller. There. So what I typically would do is I would make sure I flush the catheter through the red rubber, and then I would probably go up the patient's rectum. So I'm using a proper standing. I would go up the patient's rectum, and I would probably go up about this far, and then slowly administer the lubricant in water solution. And I probably wouldn't do 60 cc's. That's a little bit too long. I'm going to start at the bottom. I'm going to add on another layer. Now I'm going to add on my conforming stretch gauze. Stay right there. Good boy, Alfred. You're such a good boy. Okay. So I'm going to take the vet wrap, I'm going to unroll it, and I'm going to roll it back up so it's not too tight. When I'm re-rolling it back on the patient, sure it's not too tight. And so my toes are still exposed. Okay. Oh, just perfect. Come on, buddy. I'm going to place the splint on. It's nice and snug. Good boy. Cover it with some stretch gauze. So split bandage is placed. Bandage. This does have a splint in it. It's not a cast splint, so I don't need that particular tool to saw it off. I'm just going to use bandage scissors. Now I'm going to go up from the top and I'm going to go down. I'm actually putting my finger to make sure I have enough space so I'm not cutting the patient. Also, I'm going to pretend if there's a wound right here, I wouldn't go along where the wound is. And then to take off. Hold, this is the I am going to do another layer for it. Alrighty. Now I'm going to do the layer of stretch gauze. So this has to be fairly tight, but not to the point where it's too tight. Typically we sometimes do this for edema or for emergency situations. There's bleeding. How you place a proper belly band. Okay, so I'm gonna, this is my patient, I'm gonna do some triaging on him. The first thing I'm gonna do is look in the inside of his mouth to check sure there's nothing lodged in the back of his throat or anything, which there's not. Also what I would do is look him up and down, making sure that there's no lesions or bite wounds or anything like that. Feel all over, and then check to make sure that there's no open sores, lumps, bumps, that the owner wasn't aware of. I'm going to take a listen to his heart. So I listened to his heart for about, I got 21 beats, so I'm going to times that by 4 to get my average heart rate per minute. I'm also going to listen to both sides of the heart to make sure I don't hear any murmurs. After I listen to the heart, I'm also going to listen to his lungs, make sure I don't hear any crackles in his lungs, and I would listen to all 4 quadrants of the lungs. So he's hard to kind of get a respiratory rate on because he keeps sniffing. And then for meditation, I would say QAR, he's quiet and alert. He's shaking because he's a little bit nervous and scared. And then the last thing I would do is check gum color. And it says mucous membrane, which is nice and pink. And then I would check the CRT, which is 1, so it's under 1 seconds. So it means his capillary refill time is a good time. So I'm going to pretend he has a wound right here. What I would do is if he had a wound right here, I needed to clip and clean it for the doctor. I would first, I would put some lube on top of the wound, and then I would shave it. So I shave it with these clippers and clean up the area really nice. Then I would clean up with some Chlorhex and distilled water, and then what I would do is I would place Dermalone on a Telfa pad and stick it right here. So I'll just open this one up. Except the bandage anyways. So I would put Dermalone on the Telfa pad and then put it over the wound. And then I would put enough pressure when wrapping it. And I would obviously make sure I would not go over, make sure that I would not go over his penis since he is a male. Good boy. And I've already loosened the vet wrap. It's not happy. Alrighty. Sometimes some people put a tape around here to help prevent it from sliding back. But this is how you would temporarily repair a laceration until a doctor sees the patient. And so right now I'm currently wearing gloves, a mask, and a lab coat over myself as additional protection from bacteria getting in my face and underneath my nails and all my lab coat. Okay, so I'm doing a preliminary assessment, so I will be probing the teeth, checking all around, checking to see if there's any pockets or abnormalities around the teeth. So I will be charting the teeth based off the dental charting as we hear to see if there's any, this is where I would mark any pockets or gingival recession, also if I notice any fractured teeth, but I would go along the gingiva checking to see if there's no deep pockets underneath the gingiva line. And then I would go back also to look, make sure I'm doing the lingual side of the mouth, checking for pockets. Okay, so we don't have proper curettes for all the teeth at our practice, but we use tartar crackers, and also our prophylactic scaling is able to go underneath the gum line or the gingiva. But before I would start scaling her mouth, I would go along where there is significant amount of. So after using the tartar crackers, this is my one curette that I'm just gonna go underneath the gum line. This one. So now I have curetted underneath the gum line. This is my hand scaler that I'm just gonna scrape the residue. I'm gonna go on the tooth. I'm not gonna. I have used my tartar crackers, used my curette, and used my hand scaler. I have a ultrasonic scaler that I'm going to use to finish cleaning the remaining of the teeth. And after that, I would be doing a polish. This ultrasonic scaler is allowed to go underneath the gum line, so I'm going to go in circles and then we'll use the side. I will not. So now that I've ultrasonic scaled her teeth, I've gone on the outside and the inners, all of her teeth. I have scaled everything. I am going to start polishing. So this is Propy paste. I'm going to take a little bit of polish, and then I'm going to start from the back forward, and I'm going to start polishing her teeth. And then go in little circles around the whole tooth, just slightly underneath the gingiva. Okay, so the reason why I am polishing after the scaling is because the scaling does create small little scratches on the enamel of the teeth. So I'm re-smoothing out the teeth to prevent any plaque buildup or bacteria buildup to develop more tartar and creating issues. Okay, so now that I have polished all the teeth, I am going to rinse off the polish. And this is a nice little tool because it has water squirting and with a little bit of pressure, air. I have to make sure I have to get all of the surfaces of the teeth, so I may rotate her head. Okay, so now that I have polished the teeth and rinsed them off, I'm going to kind of paint the fluoride on each tooth. After Dottie's dental today, I'm going to review as if I would, if it were to be an owner, and what things to look out for since she is being under general anesthesia today. So typically, we would let the owners know. She didn't have any extraction, so it wouldn't be necessarily to feed her soft or canned food for several days, but I may have her, the owner, moisten the food just because her gums may be just a tidbit bit sore from the cleaning today. I would also require the owners feed a half a size meal as her meal home later tonight. And then I would just also make sure there's any vomiting or diarrhea or anything like that.
Okay.
And are you okay, Dottie? Okay. I also would inform the owners on preventative things after they get home, after a few days after the dental cleaning. So giving CET dental chews or ingredient dental chews, or actually to teach the owner to learn how to brush their dog's teeth with an actual toothbrush, as well as a doggy toothpaste. I also would suggest maybe even TD dry dog food, and that helps to prevent plaque and tartar buildup over time.